Perfect. So welcome everyone. My name is Kelsey Erickson. I am the SafeSport director here at USA Cycling and also in charge of anti-doping and athlete well-being. We are thankful to have you here with us today. I imagine many of you were with us on the call on Monday. So welcome to those of you that have returned and also to those that are here for the first time this week. I'm going to go ahead and just do a little bit of housekeeping kind of before we get going. The first thing to note is that this is being recorded, so we will put it up live. I know a lot of people weren't able to actually make this session today, and so this will go live on our resource page on our website shortly after the webinar is over. So just know that it's being recorded. We are also going to limit the chat, just like we did on Monday, to save that for the end when we have question and answer. So if you got the information, you'll see how you can use Zoom, and there's a chat button. You'll be able to send questions to me. My name is Kelsey, as I said, so you can send those directly to me if you want, or you can send them to everyone, but to me will be easiest, and I'll remind you when the time is for that. We've got everyone on mute right now just for the sake of there's a lot of people on here, and we want to be able to actually hear everyone. So without further ado, what I want to just lay out in the beginning is what we're going to offer you today is the information that we have at this moment. COVID-19 is a constantly evolving situation. And so what we're going to offer to you today is the information that we have, the resources that we have available, but we're not going to tell you what to do. Ultimately, it's your responsibility to take these resources back to your specific context and apply them given what local restrictions might exist where you are, bearing in mind that we're all facing slightly different situations. So we're going to give you the information that we have. We're going to continue to update you when we have new information, but I just want to lay that out in the beginning that, this is information for you to take away and make the best informed decisions that you can. And we're certainly going to continue to provide you with the information that we have available to us. So just to give you an idea of what we're going to cover today, we're going to start out with a medical update from our Chief Medical Officer, Dr. Roshon. Sorry about that. He's going to provide you an update on the current status of COVID, reiterate some of the key points, and then he's also going to provide you with some key data and evidence to back up some of the things that we've been talking about in the webinars to date and kind of the up-to-date information that we have. Then we're going to introduce to you some additional tools that we've created, in particular around group rides and kind of returning back to being back in our clubs and with our teams. And then we're going to end it with an opportunity to ask questions directly. So that's where we'll use our chat feature, and I will pitch those questions to Dr. Roshon or whomever they are directed at. So this just kind of gives you a heads up of what's to come. And I'm going to go ahead and kick it over to Dr. Roshon now, who is going to provide us with an update on the status of COVID. So Dr. Roshon, over to you. Hopefully we can unmute him. Just hang tight for a second.
There you go. Can you guys hear me now?
There you are. All right. I'm shutting myself down.
Okay, excellent. Thanks, guys. Thanks to everyone for being here. Last time we did this, we were trying to get through a whole lot of stuff, and we didn't have a whole lot of time to go through the evidence around why we think the way we do. Kelsey mentioned that things are changing fast. We have learned so much about this disease just in the last couple of months, and it really is still rapidly evolving. I thought it was worth the time to go through the evidence, basically the why of why we have come up with these sort of recommendations that we have. And I think if we can all understand what that evidence is, then we can understand more why things are changing in the future as more evidence comes in. So go to the next slide, please. As we mentioned, this is all about managing risk. There's nothing that we can do to drive the risk associated with cycling to zero, and there's nothing we can do to drive the risk of COVID to zero. So we really have these two layers of risk layered on top of each other. And so the question is, how do we reasonably minimize that risk, knowing we can't get it to zero, but yet wanting to be reasonable? And I want to start with four key principles. So I think if we can if we could all completely agree on this, then it would be a wonderful world. Maybe we can't all completely agree, but at least this is the best evidence that we have so far. So principle number one is that this virus, SARS-CoV-2, the virus that causes COVID-19, is very easily spread because everyone is basically susceptible to it. But it's also controlled. It's similar to influenza in how it gets spread. It's not nearly as transmissible as measles or chickenpox or a lot of other viruses that we know of. So it's easily spread right now, but it is controllable. The virus is spread primarily through direct contact and droplets. Aerosolized spread is a big fear that a lot of people have had, and we have to still consider that possible, but it seems to be much more likely in enclosed spaces. And that really is one of the ways that we think we can begin to recommend some group riding, is because of our greater understanding of that. The on-bike outdoor activities are probably the lower risk of infection, so we have to pay at least as much attention to the off-bike activities. And then we both have two major responsibilities: the responsibility to not spread the virus and the responsibility to not contract the virus. So let me go through each one of these one by one. And there will be lots of time for questions. I think that's valuable because I want people to be able to push back on some of this if you want to. And I want to start from the beginning. We've had a lot of questions about juniors cycling and camps and all that kind of stuff. As we learn more about this infection and we've seen it spread in the U.S., initially it was thought to be almost exclusively a disease of the elderly, and that really has not panned out as much. It can be, anyone can get it, and it can cause some pretty significant disease even in the junior age population. So that's why we want to be careful about it. Okay, so let's go through principle number one. The virus is easily spread, but it is controllable. What is the evidence behind that? We have now, millions and millions and millions of cases that have been able to show us how this has spread. The initial experience from China, where they did a review of over 75,000 cases, it showed a reproduction number, that transmissibility. If I have the virus, how many people do I shed it to? Of about 2.5. And normal influenza is 1.3. So most of that difference is explainable by the fact that everyone is susceptible. There's no vaccine, nobody has had this before, whereas there's lots of cross-reactivity and cross-immunity to influenza and the fairly effective vaccines that we have to influenza. That shuts down the normal transmissibility of influenza, but we don't have that yet for this virus. That is a key principle because we know how it's spread, and because we know that it is controllable, we've been able to put in place measures to control that spread, and they have been effective. If you look at the rate of growth of cases before we started social distancing and extra careful hand washing and mask wearing, it was growing incredibly fast, and we have seen it shut down. If we were dealing with this with a virus as easily transmissible as chickenpox or measles or a number of other viruses, we would not be having this conversation. It is spread easily right now, but it is controllable, and we have done a reasonable job of controlling it. And I've tried to put the references that I'm going to be talking here, because I know I want people to check up. I want people to look at this and come to their own conclusions rather than just trust everything that we say. So that's principle number one. Number two is there we go. We now know that this virus is primarily spread through direct contact and droplets. There has been a lot of concern about the risk of aerosolized spread. There is likely some aerosolized spread, but that seems to be happening much more in enclosed spaces. A lot of the initial data that came out was very experimental, and I've put a couple of these papers here. This first one is the one that really got this all kicked off in early March. They looked at how long the virus can survive on surfaces and in an aerosol. It was completely experimental, had nothing to do with patients at all, and it was a very artificial experiment. So unfortunately, some people took that and ran with it and caused maybe a little bit of panic that there's a high degree of aerosolized spread, whereas in the real world we haven't seen that. They did a similar thing at the University of Nebraska. Very interestingly, they were able to detect the viral RNA in some air samples, but they were never ever able to culture the virus or show infectivity of any of those air samples. So as far as we can tell, while we see some cases that make us think aerosol spread is likely in some cases, it does not seem to be the majority of spread. It's majority spread through droplets in direct contact. And that's key because that is what allows us to control it. Simple hand washing, decontaminating surfaces, and preventing the spread of droplets from infected patients are by far the most effective way to do that. Okay, next one is that because of that, low risk of airborne infection, as far as we can tell, the on-bike outdoor activities are probably the lower risk of infection when we're talking about cycling. So we need to pay at least as much attention, if not more, probably much more, to the off-bike activities when you are in the hotel, in restaurants, in stores. That's where you're more likely to come in contact with transmissible virus. It seems like outside in the world, in the atmosphere with UV light, it does not seem to be as easily contained. Once again, we have learned a lot about this in the last couple of months early on. The right thing to do was to be extra cautious. As we learn more, we can probably back off a little bit of that caution if you want to be reasonable. Again, nothing's going to get us to zero risk, but two papers here I think really show that quite nicely. So in this first paper, transmission seems much easier. It's 19 times higher in enclosed spaces than it is outdoors. And in another case, they studied 318 individual outbreaks. That's over 1,200 individual cases. And there was only one outbreak that involved two patients that occurred outside. All of the rest of them occurred inside. So that's less than 0.2% of cases where the spread occurred outside. Now, again, that's a lot of cases. That's a lot of outbreaks. It doesn't tell the whole story, but that is, to me, quite reassuring that the outside might be the most safe place. So then the next thing is that, again, we have two responsibilities. One is to not spread the virus if you have it. And the reason this is important is because we know very clearly transmission can happen from asymptomatic patients. So I may get the virus on Monday, right? Here by 3 or 4 days later, I could be spreading the virus, but not even be sick yet. And it's really that couple of days where asymptomatic people are spreading the virus that really contributes to the spread. What that means is you can't just wait until you're sick to do the precautions to keep you from spreading the virus. You have to essentially assume that you have it and try not to spread it to other people. You may not know that you're infected, so we have to take universal or constant precautions to prevent the spread anyway. And that's key. It's inconvenient sometimes, but that's the way we're gonna keep this infection controlled. The best way to ensure that you don't spread the virus, back to principle number one here, is to not get it. And so we now have to take the precautions to not contract the virus. If everyone embraced these two things, the rate of spread would clearly drop. And so I have a couple of different references here. One, just looking at the simple things that we can do to lower that spread. Looking at, if you wear a simple cloth mask, how much we can drop the rate of droplet spread from an infected person. That's the primary thing the mask does, is it protects you by keeping you from touching your face, basically. It does not filter the air enough for you to stop getting it. It wouldn't protect you from measles if this was measles, but it's not. And so, but it does keep you from touching your face. The most important thing it does is if you have the virus, it keeps you from spreading it to other people. So it's really sort of an egress, getting the virus getting out of you and getting to other people. That's what the mask does. If we all paid attention to these things, the rate of this virus spread would drop precipitously. So next slide. So I think that's what I have. I know that I think if we take those 4 principles, that it is controllable, the spread is controllable, that it's the indoor stuff is the most dangerous, that we all have the responsibility to stop the spread. If we embrace those, then we can probably ride safely. want to talk just a little bit about mask recommendations because there's a lot of different thoughts going around. If this was truly an airborne spread aerosolized virus, then we would all need to wear a very tight-fitting filter mask that filtered all the air coming in. That's what we do in the hospital when we're doing things that generate aerosols. When we're working around a COVID patient that is on a ventilator and can't control the aerosolized spread, then everybody in that room wears one of these masks. I don't think you can ride in one of these, right? They're difficult to breathe through. They don't last. They don't keep their filter capacity forever. And so once they get wet, they don't work as well. So we don't think that you need to filter all the air that's coming into you. A simple cloth mask to prevent you coughing out droplets and passing the virus, and to prevent you from touching your face, probably all you need to do. What I tell people is if you're going for a long ride, take two. Just put one in your jersey pocket. If this one gets gross and sweaty, you can switch to another one. If you're going on a group ride, this is probably a good idea. And so we'll talk more specifically about those recommendations later. So later we'll have a chance to open those up for questions. I'm happy to take any questions on any of those principles or any of that evidence. And we certainly don't know all the answers yet. It's changing fast, but this is the best information that we have as of today.
Awesome. Thank you so much for that, Dr. Roshon. And next up, we're going to introduce some of the tools that we have, particularly in relation to group rides and training back together. And I apologize that the slides keep getting really sticky, but hopefully I will be able to time them correctly. Just to reiterate what Dr. Roshon said, we will make the evidence and the different research that he referenced, we will be adding that online. So you'll be able to access those articles via the links that I accidentally clicked in the middle of that presentation. So next up, we've got Tara, who's going to walk through some of these resources with us.
Great, thanks, Kelsey. So my name's Tara McCarthy. I am the Director of National Events, and I'm going to guide us through some of the tools that we have available and some that will be coming out shortly after this website. So this here is the actual landing page for our COVID resources. If you haven't seen this, you can find it by going to our homepage. It's right across the top there, and you can hit Learn More, and it'll pop you over to all of our different resources. And some of the things that we're going to show you next will be added after the webinar. Kelsey, if you can move slides, thanks. So here we have our group ride recommendations. And I'm not going to go through this in full, but I do want to point out that risk continuum. That's pretty important when you're considering what your operations are going to be, whether it's a group ride, whether it's a skills clinic, whether it's a meeting for your junior club parents, and consider it just, this is really about the size and the scope of what you have going on. And Chuck is going to go into this in a little bit more detail in his scenario-based slides towards the end of the presentation. But on the left-hand side, we have the low risk, which is the solo rides, where you're by yourself, where you're not interacting with people that you don't know. You're in an area that you feel comfortable with. That's really on that left-hand side of the risk scale. And on the right-hand side, you have the higher risk, which is your larger groups of people. So people that you're going to be interacting with that you don't know the health history of, that you aren't familiar with where they've been traveling. And also, as part of this risk continuum, think about what the local transmission rates are. So on the left-hand side, we can potentially look at North Dakota, where we have a small number of cases, so low risk, versus the right-hand side of high risk, which would be New York City, which has been the epicenter of our country's pandemic. And on the right-hand side, it just alludes to what Dr. Roshon was talking about in terms of our own personal responsibilities when we are riding or being around others. So how am I not going to spread the virus, or how am I going to prevent myself from being in a place where I could potentially catch the virus? So Kelsey, if you can move forward, thank you. So some things to consider for your club or your team are club and team guidelines. These can be self-health monitoring. We have a great rider health checklist that you can actually download from that resource page and send out to your entire team. It goes through the WHO's symptom list, travel, etc. So it's something that you guys can send out and say, hey, make sure that you're monitoring your health for 14 days prior to coming out to a group ride. We just want to ensure that everybody's being safe. Also, think about whether there's any policies that you want to ask your members to adhere to for meetings, group rides, skills clinics, etc. And some of those might be come self-prepared. So if you're out on a group ride that's of length that you need extra water bottles, make sure that everyone is carrying their own fluids, their own food, their own tools in case a chain breaks, in case someone gets a flat. Something that Chuck actually brought up. Chuck is someone who always seems to help stranded motorists or people who get into vehicle accidents. But if you're someone who typically stops if they see another rider who's broken down, make sure that you have gloves, make sure that you have a mask in case you want to help that person out. Also consider reducing the intensity of any training rides that you guys have. You don't necessarily want to put stress on the local health system by having a scenario where people could get more injured than just your normal Saturday group ride. So consider some of these things. Also, if you are a junior club and you are creating these policies for your club or your team, make sure that the riders, guardians, and parents are receiving this information. You want them to be knowledgeable enough to be making safe decisions for their children. And next, I'll talk about guidance for group rides. If you think about that continuum that I talked about on the last slide, that size of the ride is where we're going to see the difference between high risk and low risk. And as Dr. Roshon said, the smaller that you go in size, it's not going to get you down to a zero risk scenario. It's definitely going to reduce the potential there, but we're never going to be in this zero area unless you are truly solo riding, not coming across anybody else. Something else that you should consider is a lot of different areas right now have mass gathering restrictions in place. And if you are someone or your group typically organizes a large group ride, you may want to check in and see what those mass gathering restrictions are. Your numbers could potentially trip that and you could be out of the regulations for your area. And as Dr. Roshon said, we do need to be very considerate of those off the bike scenarios. And a lot of group rides have congregation points. And some of those are the start and finish areas, as well as refueling stops. Think about how you want to create those areas in terms of a reduction in numbers. So if you're meeting normally at the local coffee shop in downtown, you might want to change that starting point to a vacant parking lot where people can spread out when they get ready. Also think about whether you want to send people out in smaller groups. If your group ride is about 50 people strong normally, think about whether you want to create not necessarily a reservation system, but 10 people arriving at a time and departing your starting area at a time. This is going to prevent that congregation at the start and finish area, as well as those refueling stops. Now, Dr. Roshon talked about masks and again, the responsibility of riders, and this could be part of your club policies or the group ride policies, is to ensure that people are riding with masks or at least having them in the congregation areas. Again, something to think about, especially as you're looking at your local transmission rates. Now, we've received a lot of questions regarding single file rides. This could be out on the mountain bike, this could be out on the road. This is something that you guys seriously need to think about in terms of, does this have to be part of your normal operations? We are seeing across the board that normal operations do need to change during these times. And if you typically have pace lines going or you're out on single track with 30 people, think about how you can reduce that wheel-to-wheel contact. You know, we've been talking about what the proper distance is, and Dr. Roshon, if you could maybe talk about this, when we get to the question and answer portion. But, you know, we're thinking that there might be 20 feet of space between people would potentially be a safe distance between riders. So think about how that is going to affect your normal ride. Again, do you separate people by having different arrival and departure times? If you're on a junior ride, you may need to consider having more ride leaders, so that way you guys can spread out further. You have a leader, you have a couple middle of the pack leaders, as well as your follow person. Now, in terms of skills clinics, this is a lot of the same guidance as group rides. But something that you should consider is pre-sending your participants some electronic information regarding what's going to be happening at the skills clinic. Allison Dunlop has prepared a fantastic pre-clinic document. It gives instruction as well as photos as to what each of the different skills are. This is going to help prepare your riders and your athletes in terms of reducing the amount of interaction that your coaches have to have with the participants. Something else that you need to consider, if your normal skills clinic is a 30-person skills clinic that takes place in a typical city park, consider where you can do that where everybody is much more spread out. That way you can meet some of those social distance guidelines of 6 feet. Again, this might require moving your location. It's going to require potentially added leaders or coaches in which to address different groups. But think about all these different things where you're going to be able to spread people out and reduce the number of people. Now I'm going to hit upon waivers just really quick. I used to run a local women's mountain bike group in town, and every ride we had people check in and sign waivers before the rides and skills clinics. Think about how you can do this electronically rather than in person. And what this also allows you to do, especially with the check-in, is if you do hear that a rider has gotten sick after your group ride, after your club or team practice, that you will be able to alert the other riders who were with you that day that someone has gotten sick, and for them to then monitor their health. And one thing that I did forget to mention, if you are doing a group ride that's of a very large size, think about the social perceptions that that's going to potentially cause for your club or your sponsors that are lined up on your kit. If you're sending 30 people out and local restrictions are groups of 10, just be cautious about what that might do in terms of your sponsors getting negative publicity, etc. So one more thing, sorry. A lot of these guidelines are part of our event organizer guidelines. So if you're looking for contact list registration or waivers, you can check that out on the event organizer resource page. And I will now turn it over to Chuck to talk about insurance and USA Cycling waivers.
Great, thanks, Tara. This is Chuck Hodge, Chief of Racing and Events. One thing we covered a little bit on our Monday webinar for event organizers, is a lot of questions about liability, insurance with USA Cycling. I'll start out by saying that we're not offering legal advice here. The variances and what could happen and the jurisdictions and everything else make that impossible. But what we will do is talk about our insurance and the policies that impact, especially our clubs and coaches. So I'll chat about that a little. This information is pretty readily available. If you go to our website and just search for insurance, there's a page that provides background on the policy as well as the applications, which have more information for these different policies. In general, USA Cycling's liability policy covers bodily injury, and that includes sickness or disease. So if someone makes a claim they contracted COVID-19, the policy will respond under its duty to defend. Just like with any other claim, whether the policy pays damages is dependent on the facts and circumstances of that claim. And again, that applies to crashes, COVID, anything you're going to get a claim on. I want to talk a little about club activities. This is come up, and we decided to wait for this webinar instead of the event organizer. For club activities to be covered, the club must be current with USA Cycling as a registered club and have purchased the optional club liability policy. And the price of that is dependent on the size of your club. The insurance requires that rides or activities must not charge an entry fee, and you must obtain a waiver. It's important you must also follow any local requirements and laws, especially in relation to the group size. If local policy or law says 10 people and you put 30, you're in violation of legal standing at that point, and the insurance won't cover that. A little bit about the waivers that Tara talked to. Our preferred partner is Bike Reg. If you're doing a club ride, you can set that up for free in Bike Reg, and that'll allow you to collect those waivers electronically. You just send out a link to the people doing it. It's stored on our system and theirs. They will make a change in the next couple of days to allow clubs to institute that electronic waiver without having to have a USAC event permit. Talked to their CEO this morning. That should be done very quickly and will be communicated. If you are doing an event that charges an entry fee, that's actually an event. You can get the same insurance coverage. It needs to be permitted as like a USA Cycling fun rod, and you pay an insurance surcharge on that per person. But if you're doing a club activity as a club with that insurance, I just described that, you just can't charge an entry fee. Coaches have a very similar coverage and insurance policy. The difference there is the coach will need to make sure that that client they're working with signs the waiver, and they retain that. If there's a camping clinic, just like an event, which stuff's going to be charged for, that does can be permitted a little differently, and we can provide the insurance coverage for those. And all of these are after our May 31st deadline, which was we're not taking permits before that, for events before that. So I hope that clears things up. If you have more specific questions, it's sort of hard for us to answer every little question in a group webinar. So I've tried to give you some basics here. Feel free to send a note back to us at USA Cycling. Event services at usacycling.org is a email you can use, or the general membership at usacycling.org, and that'll get routed to the correct people in our organization. So that's it for now on insurance and permits.
And Kelsey, I did cover this before, so if you just want to continue on.
Awesome. So those tools, again, will be available on our website. I actually just got a message that they already are. So next up, I'm going to hand it back over to Chuck, who is going to take us through some scenarios that we might encounter as we're moving forward.
Great. So, Tara and Dr. Roshon have talked about risk factors, and the toolkit that Tara just described. I'd recommend that especially clubs and groups that ride together do download that. It'll play into the scenarios. We're going to look at 4 scenarios, sort of running that risk gamut. As long as it works with this number of people, I've created some very simple polls. So I'll read these out because we have some people that may not pop up on their monitor. I'm going to drop a poll out to you guys, give you about 10 seconds. It's pretty simple, yes, no. And you're going to answer whether you would ride under this scenario or not. We'll pop those poll numbers up and see what everybody thinks. And then we're going to talk a little about mitigation. So we'll quickly run through these. The first one, for those who don't see their screen, is you've been staying at home and working from home for weeks. You decide to go out for an hour-long road ride on a quiet country road near your house, and you're going out alone. So I'm going to throw the poll up here. And it says, would you ride under scenario 1? So if you guys can click yes, no, and you're moving quick. And I'm going to give you a couple more seconds. And the results are what I thought. So I'm going to go ahead and end this and share the results. 98%. So I think everybody's taken into consideration that you're riding alone, you've stayed at home, it's road ride by yourself, probably pretty low risk. 98% of you say that you would go ride in those conditions. So let's look at some mitigation here. Again, very low risk from COVID-19, not be interacting with others. As Tara said earlier, I carry a face mask and my little plastic bag with my phone and hand sanitizer. if I need to go into a shop to get some water or need to stop and help a rider change a flat, it raises that risk for me. So I'm going to decide to carry that with me to help mitigate that if I have that scenario. Let's go to scenario 2, Kelsey, and I'll read this out. You've been staying at home with your spouse, and the two of you decide to go for a mountain bike ride together on the local trail system at midday on a weekday. You expect to see a few hikers while you are out. So let me get this poll queued up. I'm going to launch it, and would you ride in this scenario? All right, it's coming across quick. I'm watching almost 300 respondents. I'll give you a couple more seconds. All right, I'm gonna go ahead and end this and I'll share the results with everybody. A little more risk here. 92% say they would ride it. 8% say they would not go out in this circumstances. Kelsey, if you can hit the next mitigation. So the risk here is higher, but not because you're riding with your spouse. You've been cohabitating with your spouse, hopefully happily, and the risk is not from that. I think we can probably agree the risk is from the hikers. So Kelsey, if you can hit the next. So some mitigation: avoid interaction with others while on the trail, pull over, let them by at a safe distance. You might pick a trail system that allows room to do that. If you're driving the trail, park away from others. As Dr. Roshon mentioned, that is it's not necessarily the on the bike activities, it's the off the bike activities. Considering a face covering before, during, or after your ride to help mitigate that risk. As an example, there's a trail system by me. I go ride, and I don't go to the main parking lot. There's a dirt road with a pullout. I can park out away from people and ride into the trail system. And I pick certain trails to ride on that trail system that are less busy. So let's go to the next scenario, Kelsey. All right, your club is holding a small group ride with 10 or less people. You know, at least in passing. The road ride will be 3 hours. We'll stop to regroup and have snacks at a gas station at the halfway point. So I'm going to cue this one up and launch it. And let me know if you'd ride in that situation. And this one's looking a little more even. Give everybody a few more seconds to go. All right, I'm going to end this and share it. So here you can see a majority of people chose not to do this ride. And Kelsey, why don't we go to the next little bit here. So the risk here is higher than riding with someone you have been living with and know the health history of. You don't know who may have been protecting themselves, who may have been traveling, who may have a coworker they've seen or a spouse that's sick. You're also going to be stopping at a public location. And Kelsey, let's look at the mitigation on this. So some mitigation, Tara mentioned, and she showed the toolkit. One thing you might consider to make yourself feel more comfortable is having club policies in place to require ride participants to follow. Aside from the on-bike activities Tara talked about, like bringing your own stuff, not sharing bottles, what we've given you is a set of club policies. If these are folks you may know well or ride with, is there a set of policies you can all agree to? And that's part of that toolkit. As an example, I pledged that I have been self-monitoring for 14 days. I show no signs and symptoms. I have taken a pre-event temperature check. I don't have myself or anyone I live with that's in a high-risk group. I haven't been traveling. The goal of those, if you can all agree on them, is to lower that risk potential and be comfortable that the folks you're riding with present little or less risk than just people you know in passing. Also consider a face covering. When stopped at the store, going in, wearing those items, whether you're with a group or alone. Make sure to sanitize and wash your hand. Don't share bottles, and utilize that rider checklist I just talked about. If you do those, are you more comfortable? And you may not be. This is a decision that you will need to make personally, just like a lot of other things in life. All right, we're going to go to our final scenario. Scenario 4. you're considering heading out to do the local Tuesday Night Worlds. This is a road ride with over 50 people that meets once a week and does a hard hour-and-a-half ride through the suburbs near the city you live in. It attracts both local riders and people who are visiting from out of town. And I'm going to cue this one up and launch it. You should see it now. Yeah, good response. We'll give it a few more seconds here. All right, I'm going to end this and share it. So basically the exact opposite as we expected of the first we sent out, that the likelihood of you feeling safe doing this is much lower. Kelsey, if you want to go to the next little bit. So I think we know the risk here is more substantial than other scenarios. All those risk factors Tara talked about, exposure to a group with unknown risk factors that you probably can't mitigate through an agreement, close proximity to riders from outside your community. You notice I had this next to a city. What if this is just outside of New York? Is that different from outside another city? And really, depending on the local situation, you may just be illegal. A lot of places in the country are limited to 10 now. Group of 50 people blasting down the road where they're saying only 10 is not a very good look for our sport right now. Kelsey, I think we have a mitigation on this as well. So shows the highest risk. If you're going to do this, you want to follow the most stringent mitigation and efforts possible. I would not do this right now. That is my choice to make. Right now, in a lot of places, it's going to violate local policy or guidelines. What I do want to point out with the scenarios, we are looking at getting events back. This is a snapshot in time, and you're probably thinking about this based on your location. That will change in the future. We're hopefully sooner rather than later going to get to a point where wide community spread is very much decreased, and the country will be opening up. And this may be in an area that, right now New Zealand, as an example, has virtually eliminated COVID. I would feel a lot differently about riding in this scenario, in those situations, and I think most of you would as well. So I hope that was a helpful exercise and points out some of what we've been talking about. And we have made these scenarios available just on a simple one-page handout, so you can download those and talk to your teammates and club members and other folks about them. So hope that was helpful.
Awesome. Thank you so much for that, Chuck, and for everyone so far. So this is kind of the final section of the webinar, an opportunity for you guys to ask questions and have those answered live. So I see that I have a number of questions. I've got a couple to get us started. And if you guys can just add your questions to the chat box, you can share them to everyone, or you can share them to me. That's Kelsey specifically, and then I will pitch those over to the corresponding person. So first off, I've got a couple questions for you, Dr. Roshon. The first one is, how do scientists or researchers know how someone gets infected?
I unmuted you, Doc. You're good.
There you go. Good. Thanks. So how do we know? So it's especially in some of the more controlled areas where the virus has not gotten completely out of control and the contact tracers become overwhelmed. It's amazing the detail that they can go into. So they are asking questions in the East, in most of Asia. They actually have apps that will know who you've been in contact with and for how long. From that, they can go back and trace, how the virus spread from one person to the other and what was your interaction with those people. And it's not perfect, but this has been going on for a long time. This is actually not a new science. This is a very old science. We're used to doing this every year during influenza and whenever there's a pandemic flu. And again, since this seems to be spread very similar to that, these are fairly well researched and well understood techniques to be able to do that. And the bottom line is what we find is the dangerous things are inside in large groups. I think it's going to be a long time before we see anything that involves an indoor large group happening, until we get widely distributed and very effective vaccine. I think it's going to be a while for that. So your NBA games in the stadium are going to be a while off, I fear.
Awesome. So I'm just going to warn everyone, we might not get to all the questions because I'm seeing that I have like a million, but we will answer them at some point, and some of them will answer multiply or all at once. So for those wanting to know if you can still get a USA Cycling mask, glad I could model for you. Sure, why not? Shoot me an email and we'll add it to the list and we'll get that going. I'll send you my email. A question related to that, and we touched on this on Monday, but I think it's certainly worth reiterating. Dr. Roshon and us, are we recommending wearing masks while riding?
So if you're out riding by yourself or with a close family contact, you and your spouse out for a ride, you're not around any other people, I don't think you necessarily need a mask. The point of the mask is to prevent you from spreading it to other people. If you're in a small group, even of people that you trust pretty well and that you know pretty well, I would suggest you wear a mask. And so what I would do is take a mask with you if you're going out solo or with a group of really, really close contacts like family members. You don't have to wear it, but then if you end up, near other people, or, you can never tell when the flat's going to happen and somebody stops, and then you can wear the mask. The larger the group gets, the more helpful the mask is. I would not go on a large group ride with people I didn't know, or even a medium group ride with people I didn't know really well without wearing a mask. And it's all about that, those droplets. Another question that came up was, can you pass it? Can you transmit the virus through sweat? The answer to that seems to be no. We don't see any evidence that there's virus in sweat. But the question is the droplets. If somebody's coughing and that droplet comes out, how far does it go back, and what's your likelihood of getting in that area of the droplets and getting it? It's much, much decreased if they're wearing a mask.
Awesome. You just answered another one of my questions, so I can skip
Nice.
that. Not sure if there will be an answer to this one, but the question is, if there are people that are asymptomatic and they are unaware of it, how do we keep it from spreading if they come to a ride?
Yeah, you can't. That's why you wear a mask. So again, I think there's two parts to that. So first of all, truly asymptomatic people can spread the virus for a few days. Most people end up getting symptoms at some point. This is clear now. We know that. Then the question is how long is that asymptomatic spread period? And that's why everybody needs to be wearing a mask, so that even if you are asymptomatic but spreading, you're preventing that. The other thing is, people that have been around people with COVID, a known sick contact, or people that have been traveling from an area with a high degree of spread, those folks shouldn't be going on rides. So you need to quarantine yourself for 2 weeks, about 14 days after you've been around somebody that's been sick, or after you've been to an area that has a high degree of spread, so that you're not in that asymptomatic period. Once again, that's back to our responsibility to not spread it to other people. And then the other thing I'll just say, it needs to be said, we're all trying to be tough guys, and even if you don't feel great, you're going to go for a ride anyway. You can go for a ride, just go solo. Don't get into a group if you have any symptoms whatsoever. The days of being a hard man, I fear, as it relates to this, are over. So if you have any symptoms, do not get in a group.
Awesome. Just a clarification question around the recommendation for how far apart riders should be if they are in a single file. We're saying 20 feet for single file, correct? The 6 feet was in relation to standing next to someone, or if you're to their side.
Yeah, I'm going to just tell you, nobody knows the answer to this. My thing of 20 feet is to say, leave a lot of room if you're riding with people that you don't live with. And that's if they're wearing a mask. If they're not wearing a mask, then I think you need to be even farther away. We don't really know how far. That one paper, the Belgian-Dutch study, that was not really a study. It was really an opinion piece and some mathematical modeling. It was very non-clinical. It certainly doesn't give us the answer to the question. We don't have an answer. as far as we can tell, there has not been a significant amount of spread from scenarios like that. Now, there also hasn't been a whole lot of people riding in scenarios like that. I think if you're both wearing masks, 20 feet apart is very reasonable. If you're not wearing masks, I don't think I would be riding with somebody I didn't know. So then you can say 60 feet or 100 feet or 1,000 feet, whatever you want, but definitely not right up behind them.
Awesome. Very practical question that I have experienced myself. For riders that wear sunglasses a lot and a mask and are finding that their sunglasses are fogging up, any suggestions? That's
I don't know what to tell you. Use anti-fog, and then you're gonna have it probably is gonna happen. You may have to sometimes make the choice between the glasses or the mask.
fair. Any difference in recommendation between a mask versus a buff or gaiter?
No, I think they're the same. It's the idea is mostly to prevent any virus. If you're in that asymptomatic period and you're coughing or even breathing hard, is the virus coming out? We want that to get trapped in the mask and not get onto anyone else.
Okay, awesome. Question for USA Cycling: will there be, or are we considering the possibility of having electronic signatures for waivers, et cetera, versus instead of hard copies?
Yeah, Kelsey, I can answer that. It's Chuck. So we are set up with Bike Reg to handle electronic waivers at all events. They're our preferred partner. They have that currently in place for permitted events. And also, as I mentioned earlier, we'll very shortly have that in place for club rods. We are working with some other providers for, just due to some contractual obligations we have with Bike Reg. We are going to open it up to other providers for things like Grand Fondos and gravel events that don't require USA Cycling license. We're in the process with the first. Right now, it's just getting through the technology and some contract language on that. There's some information we obviously need to collect to ensure that the organizer is properly covered if there is an incident. But right now, it is in place with Bike Reg and has been, and we do not have a problem with electronic waivers coming from them. I actually prefer them because the retention rate, if you're a club organizer, is 10 years on that, because that's the statute of limitations in some states. They're a lot safer on your computer than in your garage being eaten by mice. So yeah, but again, any questions specifically, event services at usacycling.org, and we can answer those.
Okay, thank you. If you have had COVID previously, like months back or a month or so back, and recovered, can you still spread it?
No. So once you are clear, as far as we can tell, with all of the data that we have, again, we're early on with this, but the likelihood that you could be spreading from that original infection is 0. What happens is the tests that they're using to detect this virus are incredibly sensitive. So it's an RT-PCR test. It's finding little pieces of the viral RNA, and people shed that viral RNA for weeks and weeks. This is not new to COVID. Lots of other viruses do that, where and these are viruses that have been around for hundreds of years, and we know how they act and we know how they're transmitted. The people make an antibody response, the virus goes down, and they're no longer infectious at all. But if you keep doing that RT-PCR test, you can sometimes find, in some cases, positive tests for up to 2 months after that. Now, so there's 2 parts to your question: is can you spread it if you've already had it? And I think the answer to that is pretty clearly no. It's not 100%, but it's close to 100%. The other question I would ask is, do you really know that you had it? Did you have a positive test, or have you had a positive antibody test? Because there's a lot of people that had an influenza-like illness back in February and were pretty sure that they've had it, and a lot of those folks didn't. So I don't want you to act like just because you were sick back in February or March that now you're invincible as far as COVID goes. You have to be careful. There were a lot of flu-like illnesses going around at that point, and seen a lot of people that thought they had it that didn't.
Awesome. I'm just going to tell everyone there's been some very good recommendations on how to manage the mask and sunglasses combination. So we can put that on an FAQ because I'm actually very impressed with the responses that have been provided. What about, is there any concrete evidence or data at this point regarding reinfections?
We don't see any evidence of reinfection. I think most of the cases of reinfections that we see are just that thing where the test can stay positive for a long time. So the test is not perfectly accurate, and what happens is somebody will get the virus, they'll test positive, they test positive again, they get better, they test negative, and then you test them again a couple of weeks later and the test will be positive again. That really, as far as we can tell, seems to be a function of the inaccuracy of the test, not a true reinfection. We haven't seen anyone that we are convinced is a true reinfection. It's known to happen with coronaviruses, but over a longer period. Some coronaviruses, you can get them, you clear the infection, but then you can become susceptible again in 6 months or a year. And so that probably will happen. Now look, if you get 100 million infections worldwide, there's going to be some weird things that happen. So my suspicion is we probably will see some of those crazy things that happen. But in general, what's a reasonable fear to have? I think that the risk of reinfection is very, very low.
Great. Another question is around the droplets. And so we've talked about kind of the larger ones. What about potential concern around droplets from talking, yelling, or laughing? Is that something that they need to be concerned about wearing a mask to cover? Or are those considered like too small to be significant?
Yeah. So again, if you're 6 feet away and somebody's talking, the likelihood of the droplets coming across is really, really low. In one of the studies that I referenced there, they took a patient in the hospital, sick, known COVID, and they did tests with an air collector that was placed 10 centimeters from his mouth. So it's about 4 inches. And talking, coughing, yelling, shouting, with and without a mask, and they couldn't find any airborne spread of that virus. They could not detect the virus at all, even though they knew this patient had a very high viral titer. So again, there's a little bit of a disconnect between some of the experiments that have been run. Whereas, yes, if you grow up the virus in a big vat and inject it into a rotating drum that keeps it aerosolized, then you can find it. If you hook up a vacuum to somebody's face, you can detect viruses. But as far as normal things, I really wouldn't be nervous about that. Stay 6 feet away. They're wearing a mask. You're wearing a mask. I think you're fine.
Awesome. A couple final questions before we wrap up. For some, there's a question around SAG vans and how to do that appropriately. If a driver needs to pick up a rider needs to get into the van, equipment, et cetera. Any thoughts or suggestions on that?
Yeah, Kelsey, I can take that one. So again, we're talking about the interaction between the SAG driver and the rider, and then of course, how many riders you can actually get in that vehicle. So if we're still talking about that 6 feet of social distancing, you're going to want to figure out how many people that vehicle can adequately hold while meeting that regulation. The SAG driver should absolutely, and I think Dr. Roshon would agree with this, wear a mask if they're having that personal interaction with the rider. You could think about whether to ask the rider to also wear a mask while they're in that enclosed space with the the SAG driver. Also make available hand sanitizer in that vehicle. That way the rider can load their bike, they can sanitize their hands, or if the driver needs to load the bike, they can then sanitize their hands after touching the person's equipment. But again, that's probably going to require additional vehicles to reduce the number of people that are in that vehicle.
And Kelsey, we do in our event organizer guide have a link to the CDC suggestion for vehicle cleaning. It's mainly geared toward ride share and taxi drivers, but we thought it was appropriate. So that is in that booklet.
And Kelsey, I'll just say that, I agree. You want to come up with plans where you could keep people separated as much as you possibly can. In an emergency, if something happens, it really comes down to the masks and careful hand washing and not touching your face. I'll just tell you, in the hospital, we are within 6 feet of people, all day. We're close to patients. We're close to patients that have COVID-19. We're close to each other. And so it's all about hand washing and those standard precautions. So I think if you have to do it in an emergency, I wouldn't want to, plan for it. But if you have to do it, then just remember that that hand washing and don't touch your face and wear a mask. Those are the key things.
Awesome. Well, I want to respect everybody's time. I appreciate that we missed a couple questions. And so if anybody wants to send additional questions, I can make sure we get them responded to. I will put my email in the Slack, or no, just kidding. In the chat box.
Kelsey, we'll be sending out a post-meeting survey. So if you guys want to address any questions that we didn't hit, you can add those to that survey. There is a section there. That way it's all in one place for us.
Perfect. Yes. Thank you for that reminder. We will be sending that out. And you can also, for those of you that have asked about getting a mask, you can email me directly to that email, or you can put it in that response to that survey. But I just want to say thank you so much to everyone who participated today. I hope that you got some really useful information. And thank you to Dr. Roshon, Chuck, and Tara for assisting me in this. And yeah, everyone have a great rest of your day. Thank you.
Thanks.
Thanks, everybody.